if you want to. Well, welcome everyone. I'm delighted to be joined today by Dr. Claire Hayes, who is joining us to talk on childhood mental health as part of our Aware Mental Health Week. Thank you, Claire, for joining us, and lovely to see you again.
Oh, it's a real pleasure, Susan, and thank you. Thank you for inviting me.
You're very welcome. So today our conversation is going to centre, as I said, around mental health in childhood. So it'd be really great to hear your perspectives on that. I guess maybe a good place to start, maybe for our listeners, might be in terms of, before we get to difficulties, maybe what you see is kind of what's normal for kids in terms of mood changes or anxiety or that side of things.
Well, it's a great question. And I think what's normal for children is for them to grow up, for them to fight to be independent, for them to want to have their own way, for them to feel resentful or jealous if there's a new sibling. You know, that's all normal. That's part of normal childhood. It's not that there's anything sinister or wrong with them. But as adults, we can sometimes really put too many expectations on children. We can expect them or want them to be really, really good. We want them to be in great form all the time. We want them to be happy. And we want that because, number one, it makes us feel better. But number two, if we think that children are not happy for whatever reason, then we can tend to blame ourselves as adults, and we can put pressure on ourselves to make them feel happy. And that can backfire, you know. So I think it's a really great starting point to remember that part of childhood is moments where children feel unhappy, cross, left out, tired, cranky, upset, as well as chorus of delighted and happy and all of
that. Yeah, no, that's a really good point, isn't it? So there's going to be a whole range of emotional experiences that kids are going to go through like adults, but I guess maybe the difference is that there's a learning of how to identify those emotions and respond to them, which I guess kind of caregivers and parents and teachers support with that kind of naming and responding.
Yes, absolutely.
Yeah. I guess I wonder in terms of there can be lots of normal anxiety, as we say, in childhood as well. I'm just thinking of separation anxiety as being something that's really normal and common at certain ages that tends to resolve itself. I don't know if you have a view on those sort of things in terms of how long. We'll get into maybe more detail, but for the things that you might expect in development of kids, like how, I'm not sure what I'm asking here, how you might tolerate that uncertainty as a parent, when to do something more active.
Okay. I think there are three things, Susan, that are really important. Three words: intensity, frequency, and duration.
Yes.
So any behavior, any child can have a temper tantrum. But if that's something that's happening on a consistent basis, lasting for a long period, and very, very intense, well, then that, and lasting for a long period, so intensity, frequency, duration, then that's something to be concerned about. It's normal for, and really important for a child, a young child, to have what we call stranger anxiety, to react if there's somebody coming into the room that is a stranger. They feel better when they're with their parents. They gravitate towards their parents. That's normal. But it's worrying, it can be worrying then if a child is, say, a 7-year-old, is exhibiting behavior like that, doesn't want to talk to a teacher, doesn't want to go on a play date, doesn't want, and is exhibiting separation anxiety. So what's normal for a young child might not be for an older child. The same with something like bedwetting. You know, as children are learning new tasks, it's normal for them to have accidents. But if there's an 8-9-year-old child who's bedwetting, well, then that's different. So how do parents know the difference? Well, in my training, and people might know I was a primary school teacher before I did psychology, and I revert back to my primary school teaching all the time in my training. But I remember being told in college that parents know best. And really, that's been my experience 99% of the time. So if a parent is telling me that they're really worried about their child, and everyone else is saying it's fine, it's normal, don't worry, I listen to the parent. Now, having said that, I've also the experience of parents worrying about their child when the behavior is, that horrible word in quotes, normal, because of the parent's anxiety. So it's difficult to get a balance, but really separating out why parents are anxious, looking at their own worries, but really listening to their gut instinct. And for me, that's important. So there's two things that can happen for any of us. We can have our, what I call our fight flight alarm system kicking off. There's danger. And that can be a sick feeling in our stomach, clammy hands, sweaty, thoughts racing, all of the normal physiological symptoms of anxiety. And that can be triggered by real danger and or what we think is danger. So if a parent is thinking their child is not doing whatever they're supposed to be doing, or is doing something completely out of the norm, well, then those thoughts are going to trigger the parents to feel anxious. If they're thinking that the child is upset or doesn't like the teacher or is worried about another child in the class, again, they're going to feel anxious. But in my view, we cannot trust that those feelings of anxiety, because they can be triggered by real anxiety, real triggers, real danger, and or what we think are dangerous. So we can trust our instinct, which is different. So our instinct is really yes, no questions. So Susan, if I was to say to you right now, you are American, what would your immediate response be? Yes or no?
No.
No. It's a beautiful day today. Yes or no?
Yeah.
So that's a yes. So if we practice yes or no questions, we really get to listen to our instinct. So if a parent's instinct then is my child's behavior reasonable right now? If they're throwing a tantrum because they've had a lot of sugar, they're tired, they're upset, other children are getting attention, well, then that could be a yes. But if is my child's behavior reasonable right now, and there's no reason to explain it except there's something that the parent's instinct is, there's something just not right with my child, well, that's something that is really important to follow up on. And then I'd suggest that parents go to their GP, number one, and follow on from there. So it's not something that there's an easy answer, except really for parents to trust their instinct, not their anxiety.
Yeah, no, it's really interesting actually, and I no easy task, I'd imagine, when someone you love deeply is seeming like something is not okay, whether that's over the course of an afternoon or over the course of weeks or months. So yeah, it's helpful, as you say, to kind of locate it in those questions and separating out kind of instinct versus your own anxiety. And I'd imagine kind of other caregivers and kind of people in the system might support in that exploration as well over time. Yeah.
Yes. Yeah, absolutely. Although it can backfire. Grandparents and friends could be saying the child's fine, is grand, don't worry. And one thing I definitely know is reassurance doesn't work. So if we're experiencing anxiety, it doesn't matter how many people tell us everything is okay if we don't believe that it is. So grandparents, aunts, uncles can be really good supports. But it comes back really to the parents to look at what it is they're concerned about. And if we go back to basics, Susan, so my view is we all do things to make ourselves feel better. And children are the same. So they might cry because then they get attention and a hug and a cuddle, and that's fine, absolutely, when they're 2 years old. Not just as good when they're 10. So they need to have other ways of taking care of themselves, of managing their emotions. So parents do things to make themselves feel better too. And a lot of that is comforting their child, protecting their child, minding their child, looking after them. And then as a child gets older, they need the independence. They need to be able to go off and do things. And that can be really difficult for parents, because they might think, is the teacher going to look after my child on the school trip? They have loads of other children to look after. Are they going to look after my child? So if the parent is showing that anxiety to their child, well, then their child is going to pick up on that. And then their child might be a little bit more anxious. So for parents managing their own anxiety and really looking at, it's important for children to experience all kinds of things, all kinds of emotions, feeling cranky, feeling cross, feeling upset, feeling left out, really to develop resilience. So while we would all possibly want children to feel happy all the time, that's actually not good for them, because it's not possible. So it's helping them realize it's okay to feel upset, sad, worried, because of what's happening and or because of what their own thoughts are. So that's, the basis of CBT, cognitive behavioral therapy. And then that's teaching them the skills as they grow older to be able to separate out, I feel hurt, I feel upset, I feel cross because I think you don't care, or because I think you're not giving me what I want, or because I think everyone else has more. So children can be very dramatic, as we know. But I choose to breathe slowly. But I choose to remember you're the boss, or I choose to do what I can. And then as adults, we can help children the other way. I think you're feeling upset, tired, worried, because I think you've had a long day today, because I think maybe you've had too much sugar, because I think maybe you're thinking the other children don't like you or don't want to play with you. But what can you choose to do to make things work? So that's empowering the child. It's not saying don't be silly, don't be feeling like this. It's saying, yes, you do feel like that because of whatever's happening and or what you're thinking, but what can you do? And then the action piece, really focusing on what the child can do and what the adult can do too. And we know with anxiety, breathing slowly really works. And anyone who's followed Aware would be very familiar probably with my exercise, tightening your non-dominant hand, hold your breath 2, 3, and breathe out. At the same time thinking, I choose to breathe slowly. But there's another exercise I'd like to share. So if you put one hand on your tummy, and children can do this and enjoy doing it. So one hand on your tummy, and as you breathe in, notice your tummy expand like it's a ball that or a balloon you're blowing air into. So breathing in, and then holding for a moment, and then breathing out. I'm going to do that twice more. So breathing in and breathing out and breathing in and breathing out. And now if you put your other hand on your chest, and as you're breathing in, notice the air going from your tummy up to your chest, and then from your chest back down to your tummy. So we'll do that 3 times as well. So breathing in, good, and breathing out. Breathing in and breathing out and breathing in and breathing out. And now one last time, if you put your hand on the top of your head, so it's like you're going up a lift and the air is going right up to the very top. Looks a bit silly, but that's okay. So breathing in and then breathing out, and the air going all the way back down again. Brilliant. So breathing in and breathing out and breathing in and breathing out. So I'm talking a lot, Susan. What's going on?
Well, it's very helpful and very relaxing. Thank you. And I guess it's worth sort of saying maybe that it's so powerful, the breathing techniques, isn't it? And I guess people think, oh, just a bit of breathing, but actually it does so much. And as you mentioned earlier, the fight or flight system, it's a direct channel of communication with that sympathetic nervous system, isn't it? So it's actually invaluable. Yes. And we can't really do anything, can we, if we're in a distressed or anxious. The first port of call is to calm the body down, then kind of do some of the other stuff that we were talking about. So I think that's really helpful. I'd say that'd be really useful to kind of people watching. And I guess I was just thinking there before we got into that, maybe when we sort of covered it, but maybe even a bit of on your thoughts about what anxiety might look like in children. What will people be watching out for?
Again, that's a great question. So we all, again, going back to, we do things to make ourselves feel better, but the reassurance doesn't work. So if children are constantly looking for attention or looking for reassurance, so they won't go to sleep on their own, that they have to have a parent beside them, or if a parent is going out, what time are you coming back? When will you be back? What time will you be back? Are you sure you'll be back? Lots and lots and lots of questions looking for reassurance. That's a red flag for me. And then children can do other things. Some children go very quiet. They don't act out. They go very, very quiet. But they might do other things like biting their nails, or maybe eating sugar, maybe sneaking some sweets from the press. They might be clinging to parents. And again, it's important to take their behavior seriously, because particularly if there's a change, particularly if a child has been very confident, outgoing, and then suddenly starts to behave like that. I'd be wondering what has happened, what's going on in the child's world. Is there something happening in school? Could the child have been hurt in some way? What is it? So really taking behavior like that very, very, very seriously and looking at what's going on and helping the child, but not feeding into it. I encourage parents not to stay beside them every night until they fall asleep, not to have them in their beds. I would say to a parent of a 7-year-old, and the child has to sleep in their bed every night. Well, what about when the child is 17 and they're saying, well, no, he won't or she won't. But then when they make that change? And that can be really difficult for parents, even more difficult for parents. So noticing children's behaviors and noticing the pattern. And some children experience anxiety and exhibit anxiety from very, very little, and then others don't. So there could be something that might have happened, like a dog barked, for instance, and gave them a fright. But then they become frightened of other dogs, and then they become frightened of going out, and then the world can become more and more narrow because they start to avoid. So the treatment in that instance is to feel the fear, Susan Jeffers' book, and face it, knowing that they're going to feel anxious. So with anxiety, it's a paradox, Susan. So it's not that people are going to feel better initially, they actually might feel worse. So understanding, just like the treatment for cancer, chemotherapy does not make people feel better initially, but we know that. So encouraging and helping and supporting children to face their fears can be very, very difficult. So distraction is brilliant. So helping children distract. So I can see you're feeling a little bit worried because I think you're thinking you're not going to be able for whatever it is. But what do you think we'll have for dinner? Or what do you think, if you were going to be organizing the news, would you put happy news first? Or it doesn't matter what the distraction is. What's your favorite cartoon? What's your favorite nursery rhyme? If you were organizing the school, what would you do differently? So engaging the child in conversation, not focusing on how they're feeling, acknowledging it, but then letting it go.
So it's really helpful, isn't it? Because I guess avoidance, as we know, is sort of the bedrock, isn't it, of anxiety problems. So and I guess what you're saying there as well maybe invites the parent or the caregiver or the adult also to tackle their own avoidance. So I'm thinking about like, oh, I don't want to go to whatever thing it is, and you might suspect it's anxiety driven, and maybe that comes up for a couple of weeks at a time, and you think actually this is more about anxiety maybe than something else. And I guess how a parent might go about having that conversation, as you say, or supporting the child in I guess maybe the ACT approach might be in terms of the wider value or the meaning for the child, or what's important to them in that activity. They like going to X's house, but so sort of linking it that way. I don't know if you had any thoughts about what that conversation could look like. As you say, distraction maybe in terms of not sitting with a preoccupation with it, but if it comes to I'm not going, what can be helpful?
Well, there, I think it's important for parents to really remember they're the parents and that they encourage and support children. But there are times where parents absolutely, it's important that they step into being the parent. And the example I use sometimes with parents, and they say, oh, my child won't go to school. I can't get him to go to school. She won't go to school. I just can't. And then I say, well, if your child needed chemotherapy, and thankfully he or she doesn't, but if they did, and they were saying no, what would you do? And every single parent I've asked that question to has said, oh, well, we'd make them, we'd make them. Because there's something in parents that they have this power because they're the parents. And children need that. They need to know that there are certain decisions that actually aren't theirs to make. It's not up to them whether they go to school or not. That's not their choice, and tough if they don't want to go. And this is where the gentle, tough love comes in. So there's just, but as the last point, so there's distraction, there's really helping children understand what it is, helping them take their own power back from anxiety, realizing that doing the opposite. So avoidance is definitely so part of anxiety, but also checking, Susan. So checking doors, hand washing, all of the behaviors that can develop into obsessive compulsive disorder. And children do it because they feel better. Adults do it because they feel better. Not doing it makes them feel worse. So really recognizing that feeling worse because they're not doing what's not good for them is brilliant. It's not bad, it's brilliant. And helping them to tolerate that. So again, this comes back to parents being able to, again, the words take their own power back, really realizing that they're not their children's best friends and it's not appropriate for them to be. And if children say, I hate you, well, that's okay. They don't have to be devastated. And that's something children might say and they might not mean. But if parents are caught into needing their children's approval, that's not a healthy dynamic. And so we need to, to get that straightened out.
Yeah, no, that's really helpful. I guess there's anxiety is in part related to uncertainty, isn't it? And I suppose what provides certainty to an extent are very clear and safe boundaries that a parent can offer. And that's quite containing, as you say, some decisions aren't negotiable. There's things that have to be done, and that boundary can actually be quite helpful. Oh, but maybe not liked in the moment.
Yes, yeah. I did training, postgrad training after I'd qualified with Professor Philip Kendall in Temple University in Philadelphia. And Phil is the world's expert in helping children and parents around anxiety. And when I was working with them, I realized that there's a pattern. So children with anxiety tend to be very bright. They can be perfectionists. They can be the good kids. They don't want to get into trouble. They don't want to make a mistake. They can, when they're little, the main relationship might be with their mother because their dad might be away for whatever reason. And not always, but a lot of times. And as they get older, they can tend to be quite controlling because they want things to be a certain way because then they feel better. So they want to sit a certain place in the car. They want to sit somewhere in the cinema. They want to, whatever it is. So the treatment when I worked with Phil was paradoxical. It was to do the opposite. So children who were terrified of getting into trouble, it was to help them get into trouble. Children who were terrified of making a mistake, it was to help them actually make a mistake and realize that the world doesn't end. People still love them just because they think they're not perfect. And that's something that gives me confidence when I'm working with people, helping parents realize that actually it's really good and important for their child to make mistakes and to realize that they're not perfect and to feel upset, so long as that's not an excuse for them to withdraw, avoid, or engage in some behavior that's not helpful. And as they get older, there's sugar, then teenagers, alcohol, vaping, drugs, all of that can be their way of managing anxiety. So it's really important saying back to basics again.
Yeah, that's great. Thank you. And I think this, I was just thinking that I could probably talk to you all day about this. There's a lot to consider, isn't it? But I suppose that maybe the main take homes are, I guess, a level of anxiety is not just normal, but it's to be welcomed. And I guess that helps us develop in the world. And there's a job in terms of kind of helping to identify and respond to emotions and noticing, I guess, trusting your instincts as a parent, knowing when to parent, not being the friend. And I guess I wonder for you, what would you say as we kind of come to an end? What's the most important thing you think you'd want someone listening to maybe take away from our conversation today?
Thank you for that opportunity, Susan. I've collapsed everything I do into one sentence. And I've called it the ABC coping sentence. So A is acknowledge. So for parents, I feel under pressure. I feel upset. I feel worried. B, because I think my child is struggling, or B, because I think other people aren't listening, or B, because I think there aren't supports, or whatever it is. And I think in brackets because it's not always a thought that drives this. If I stood on your toes, Susan, you would feel pain. At the moment, you'd feel shock because I'm looking at you through a screen. But if I was beside you and I stood on your toe, you'd feel pain, not because you thought I did, but because I actually did. So it's not always our thoughts that cause things. Real external events can too, of course. But a lot of the time it's our own thoughts. So A, acknowledge, B, because, and then C is choose. So I feel upset because I think this is terrible, but I choose to get support. I choose to take support. but I choose to take my power back, which is huge with anxiety, because anxiety kind of takes our power away. So I choose to take my power back. I choose to do what's right. I choose to so then we can do it in reverse. So parents can say, I think you're feeling upset because I think you think nobody understands you. But what can I do to help you take your own power back? But what can you choose to do right now that's helpful? So there's lots and lots of different ways that sentence can be used. But for me, it's the core of cognitive behavioral therapy, acknowledging our feelings, linking them to either what's happening and or what we're thinking, and then very deliberately focusing on helpful action that we can choose to take.
Yeah, that's great, isn't it? And I guess that idea might be sort of novel for people to think that they're, I guess sometimes making the link can be tricky. So it's great, as you say, to model that for children, to that you can offer like a guesstimate of what, and they might say, actually, no, it's because of this. And that's a helpful conversation. So it's linking thoughts and feelings, but crucially that there can be a choice in how we respond. So that you might think and feel a certain way, but there's a kind of a repertoire of things that you might do, which, as you say, is really taking power back from anxiety. So it's not about avoiding or reassuring. It's actually much more liberating to tackle it and make choices based on, I guess, what matters, and what's going to be more valuable. Yeah.
Absolutely. Welcoming difficult moments, challenging moments as opportunities to learn and to develop resilience. So rather than being afraid of them, like afraid of going into a new class or going into a class where a child doesn't know anyone else because their friends are in another class, that's a wonderful opportunity for them to develop resilience and strength. So welcoming it rather than being afraid of it.
Yeah. And modeling that welcoming. This is actually a really interesting or exciting time, and let's see how we can kind of help you through it, and what comes of it. Oh, well, thank you, Claire, so much. I think that'll be really, really valuable. Thank you for your time today. Thanks very much.
You're welcome. Thank you.